Welcome everyone to the University of Maryland School of Public Health Alumni Network's Ask Me Anything panel with 4 of our 2021 PHEEL Award winners. The Alumni Network launched the Public Health Emerging and Engaging Leaders Awards last year to recognize graduates of the school within the last 10 years for excellence in their career progression, service, and leadership. Also, just by the way, this event is being recorded and will be shared on the School of Public Health's YouTube channel. I'm so happy to have you here. I am Aparna J. Pooleri. I'm a board member of the School of Public Health Alumni Network and a 2019 graduate of Public Health Science bachelor's degree program. This event was organized by the University of Maryland School of Public Health Alumni Network in partnership with the School of Public Health, and it's open to all UMD alumni, current students, and friends of the School of Public Health. The UMD SPH Alumni Network works to promote and support the school, encourage academic and professional excellence, and facilitate career development for both current students and graduates, all while fostering and strengthening a relationship between the school and its alumni. We encourage you to support the School of Public Health Alumni Network by joining today by visiting our website, which I'll send in the chat just in a second. Your membership supports diverse programs and events curated just for our alumni community, and personal plug, it's a ton of fun. Today's conversation will be moderated by Ms. Lauren Meier and Ms. Tia Cunningham, who will introduce and conduct a question and answer session with 4 of our inaugural 2021 PHEEL Award winners. Ms. Lauren Meier is the Program Director at the School of Public Health's University Career Center, and Ms. Tia Cunningham is the Program Manager of Student Engagement at the School of Public Health. We encourage you to send your questions via the chat, although we do have some to start out with. And you also have the option when we get to the Q&A section to use the raise your hand function and be called on to ask your question on camera. With that, let's get started. Here's Tia with our panelist introductions. Thank you guys so much.
Thank you so much, Aparna, for that wonderful introduction. And with that, I would formally like to introduce our panelists for today. First, we have Mr. Martin Gesheff, a 2010 graduate in community health, who is Director of Industry-Sponsored Research at LifeBridge Health. Next, we have Dr. Mariano Kanamori, a 2013 PhD graduate in epidemiology and a 2021 Early Career Award winner, who is also an assistant professor at the University of Miami Miller School of Medicine, Division of Prevention Science and Community Health. Next, we have Ms. Rebecca Rehr, a 2012 MPH graduate in environmental health, who is director of the Climate for Health program at Equal America. And next we have Ms. Meier Walker, a 2013 graduate in family science, who is manager of health and wellness programs at the Washington Nationals Youth Baseball Academy. Welcome to you all. With that, we will begin with our first question, and I'm going to tee it off to my colleague, Lauren Meier.
Thank you, Tia. And so to get us started, and I think we'll just kind of go whoever has that first response that they're interested in, jump on in, panelists. So people have said that the ongoing pandemic has put public health on a global stage for the first time ever. What do you think the current and future public health professionals can be doing to make sure it stays that way?
Sure, this is Rebecca. I can go ahead and get started. And thanks so much for inviting us, for the honor of being the inaugural class of PHEEL awardees. It's so great to learn about my fellow awardees today, and an honor to be here with you all. So I think, my answer, it's the same that I give when people say, how can we elevate climate change as a priority, which is what I spend my days thinking about. But the answer is talk about it. We need to talk about public health and public health victories. When public health wins, we're invisible. It means because we prevented something from happening. Public health is about those upstream solutions and preventing harm and disease. And so when we prevent something, sometimes we're invisible, and that's what happens. And when you're invisible, you're first on the chopping block for the budget, right? And so the answer is talk about it. We're doing great things in public health, and it's a really fun career choice. So I think, we can't keep waiting for bad things to happen to elevate public health to the national conversation. So I just think, so talk about it. I see friends and family joining the call today. They know I talk about it all the time. And so I would just say talk about it and invite others to join you in conversation.
And I would like to expand Rebecca's great comment. I have been involved in the EP study, SARS-CoV-2 study in Miami-Dade County. And something that I am doing is to document experience, because this is a unique experience. And I think that we can teach future generations on how to implement this project from scratch, implement a project that we didn't expect that was going to we were going to have. So we are actually doing that. We are documenting everything using implementation science. So people in 100 years can actually read these papers and see how we were able to launch a project in few weeks, in a pandemic.
And I will continue to elaborate on that and pretty much piggyback off of what Rebecca said. Talk about it. And when I say talk about it, I mean advocacy. Advocacy is so huge in public health. And that's pretty much what I do in my job, advocating for underserved communities. And I cannot express how helpful that is going to be to keep moving the public health career field forward and to make changes in policies and to just make this world a healthier world, which is our overall goal in public health. Advocacy, advocacy, advocacy. Don't be afraid to ask questions. Don't be afraid to talk about what's going on. Don't be afraid to call politicians and people in power out to make changes. Advocacy, and even more, just advocating for people who can't advocate for themselves, is extremely important. And honestly, it's an honor to be able to do that in the public health field.
And to add on to everyone's comments, I think advocacy, talking about it, I think those are all great points, and recognition. I think we need to recognize the hard work, and specifically this pandemic really brought in recognition to the research community and all the efforts that happened before a pandemic. And I think on the news, we're seeing all the efforts that happened after the pandemic started, but a lot of the functions that worked well during the pandemic were created, and there's building blocks that occurred many years prior. So I think recognition and really bringing to the front all the hard work that our researchers have been building on to create this pyramid, that when we do need the researcher, we do reach a point of implementation. It's been built upon for decades, many years, and hard work by everyone.
Wonderful. Thank you so much, panelists, for your response. With that, our next question is directed towards Meier. However, we would love to hear from all of our panelists in regards to this question. But Meier, in your opinion, what is one quality, characteristic, or skill that isn't listed on the job description, but you believe that public health professionals need to possess?
Yes. So, I mean, I've kind of seen this in job descriptions, but they don't elaborate on it. I would say diverse interpersonal skills. You were going to have to interact, and I don't want to just say as far as like race, so many different people from so many different backgrounds and demographics. To have a very diverse interpersonal skill set will allow you to effectively communicate with each and every demographic and move change forward. I cannot stress that enough, definitely diverse interpersonal skills.
Yeah, I could not agree more with that. Again, sort of working on the topic of climate change, and that's yes. And I would just add that I think diligence, patience, persistence, sort of any way you want to frame that, it's that I never see that in job descriptions, but it's something you need. Sometimes public health initiatives take a little bit longer than you would like to implement, but sort of if you're working with a great team, it's the right thing, stick with it. But that sort of that diligence, and I think patience in a world where we try to get news across in 280 characters, that our patience and attention span has waned a little. And I think we need to sort of re-infuse, I would say, diligence, patience, and persistence in the field.
I think that this is important to be a good person. This opens a lot of doors. there is a point, when the search committee have a pool of applicants and all of them are equally qualified, and they do interviews, and what they are looking for is a person who will be a nice person, who will be a good colleague. And that is very important. If you are a good person, then you are going to have a lot of open doors. So that is something that you should always keep in mind.
To add to this, I would say initiative. I think that isn't well mentioned or well described in job descriptions. Many times it's not enough simply to do the job function as described in the JD. Great candidates, and I think candidates that excel in their roles after being hired, show the initiative. They want to do more, they want to learn more, and they really want to implement their role and fulfill the role beyond the words that are simply on the job description.
All right, did anyone have anything else they wanted to add on to that one before we move on? All right, in that case, I think we'll keep it going with Martin since you were the last. I'll direct this one to you first and then everyone can join in. How has a failure or apparent failure set you up for later success? Do you have a favorite failure of yours?
Oh, this is a good question. It's a tough question. So I would say you always need to learn from your failures. I think everyone will encounter failures, and I think the most important aspect to a failure is how you respond to a failure. So you should not be discouraged by a failure. You really need to take a step back and assess the situation and determine, A, how can I prevent this in the future, but B, how can I recover from this failure at this stage, right? So, I'm in the research world and I support a lot of public health related work. And I would say the biggest failure that we encounter is we spend months, if not years, developing research protocols that we think will implement without a hitch and we won't have any issues along the way. But many times we encounter failures for various reasons. But we can address them via protocol amendments or changing the study design. So I think the more failures you encounter, the more resilient you become in the future, and the better prepared you are for those failures. And over time, they aren't classified as failures, in my opinion, but I think we classify them as stepping stones, learning blocks, and minor roadblocks to get to where you're going, or the group is going, or the initiative you're implementing. So thank you.
The NIH gives one award called Innovative Award, or K99 ROO, and it's very difficult award to get because you need to compete with scientists from all over the world, not just from the US, but from all over the world. So my advice is to have huge dream. I wanted to have it, and I knew that it was very difficult. And many people told me that it was not for me. As a little background, I am a Latino. I look Asian, but I am Latino. And many people stereotyped me because of who I was, and they told me that was not for me. And I said, well, it is difficult. The best advocate could be just me, isn't it? I need to advocate for me. I knock on doors. Many of them didn't open, but the right ones opened and they helped me. I submitted my application and it was not discussed. I was sad, but my mentors told me that the summary statement was extremely good. I resubmitted it and I got it. So that was one of my biggest failures, the first submission, but persistence, as Martin was saying, persistent is extremely important. And if that is your dream, work on that, work on the dream. It's difficult, it's very difficult, but continue improving your application and take more classes, enroll in more programs, and you are going to finally get it. So I think this is my biggest failure, and that turned to be great.
So as far as failure, I don't want to necessarily say this is something I failed at, but I did not do my best. I was never a great test taker at all. And I know in high school, everyone knows you have to take the SAT to get in college. I went to a school where I was one of the few African-American students there, and I didn't get the greatest score on my SAT. So I was a little bummed out about that because I wasn't sure what I was going to do. And my college counselor came to me and was like, you want to apply to these big schools? I don't think you should shoot for that. You should probably apply for some of these lower, smaller schools. I don't think you'll get into these larger schools. So I wouldn't even say shoot your shot. Granted, I had about a 4.0. It just wasn't a great test taker for like SAT and didn't do a great job. I could have let that discourage me, honestly. I could have taken his advice. I could have decided to go to like a community college or a smaller school. Instead, I applied to Penn State and became the first person ever in my entire high school to get accepted into Penn State early admission. From there, I ended up transferring to Maryland to come home, and now I'm in Georgetown. I say that to say there are going to be a lot of people and there are going to be a lot of situations that'll push you to either give up, to not persist, to make you doubt yourself, but have passion, have confidence, believe in yourself, take those failures, take those negative comments, and just use that to propel and move forward. Because honestly, if I listened to a lot of the professors and people who doubted me because of, maybe my color or the fact that I'm a woman, I would not be in a position that I'm in today. So take those failures, use it as like power to move forward, and yeah.
And I graduated undergrad in 2009, which was not the best year to be looking for a job. So I graduated undergrad. I had not intended to go to graduate school. I thought I would get a job right away, but everybody who graduated in 2008 was still looking for a job. And so I must have submitted, innumerable applications to jobs, and I didn't get a single one. And so I, moved back home. But what I did was, I sort of pursued both a part-time job so I could have some spending money, but also a unpaid internship with the Maryland Department of the Environment, working in on environmental justice initiatives. So I was sort of interning for the Commission on Environmental Justice and Sustainable Communities. So I was sort of taking, sort of rejection after rejection, but making sure I was still pursuing the work experience that would get me where I knew I wanted to go to work in environmental health. And through that, it was actually a commissioner on the Environmental Justice Commission who was a professor at the University of Maryland, who in the School of Public Health, who wanted me to apply. And so I think so just right. So turning that failure, sort of that, be patient and keep moving forward, and know that you can build your resume with volunteer. So I understand the need for income. You can take part-time jobs to make sure you're having some income, some rent money, some spending money. But there are ways to have volunteer experiences be real, true resume builders and networking opportunities. And so just keep that in mind, I think, when perhaps, even if the first job you get or the second job you get, it's not fulfilling, it's not your dream job. Keep your dream big, like we heard earlier, and pursue it. And you can do that. It doesn't always have to be through paid work. Get a paid job. We need income. Totally understand that. And if it's not exactly what you want to be doing, continue to pursue that dream and, persist in the field that you want to do. And there are ways to do that through ample volunteer opportunities. And so that's kind of, sort of how I started and ended up, which I'm very glad I did, at the University of Maryland School of Public Health, was through connections I made in that internship role, the unpaid role that I took.
Thank you, panelists, for sharing. That was both wonderful and very encouraging to hear, I'm sure, for all of our participants. So our next question actually is directed towards Mariano, but obviously towards all of our panelists as well. So Mariano, what was the first job that you had?
The first job that I had was in Lima, Peru, and it was in a shanty town that was built on top of landfill, and they were refugees from terrorism. This town was 30 minutes far from my house, and I never experienced poverty in that way. So that was what changed my life, and this is why I decided to have a career in public health and help underserved community. So that was my first job.
Okay, I could go next. My first job, I'll say out of college, I was a physical therapy technician. So I worked with physical therapists, I helped manage offices, and it pretty much just exposed me to the inequities in the healthcare system. That's really where I got my experience with learning about some of those hands-on inequities that people are experiencing. And that really propelled me to just move forward in my career with public health. But yes, I was a physical therapy technician.
My first job, so I was a research assistant actually here at Sinai Hospital, Baltimore. So I actually started my career at the institution I currently am. And to go back to Rebecca's point of volunteering and taking those opportunities, I had volunteered at this hospital almost every summer during high school. And I was offered a research assistant role my freshman year when I was at University of Maryland at the School of Public Health. That actually really gave me the passion for the field I'm currently in. So do not be afraid to take that unpaid position, that internship. And I know everyone wants to take their time off in the summers and live at the beach or go traveling. But taking those unpaid internship roles or volunteer roles really goes a long way in helping you place into a position after you graduate, or even create or it could even lead to a position or paid position prior to graduation.
Okay, so my first job was much less relevant to my field than it feels like everybody else's. I was a camp counselor, and then I scooped ice cream. And so that did, sort of continue my lifelong passion for ice cream. That's never gone away. So those were my first jobs. So when I was in high school, those were my first jobs. And then when I was in college, my first job was, so I did work study in college. And and I guess this technically was my first public health job. But if you ever go into a bathroom at a college campus and there are informational signs hanging in the stalls or on the walls, if you were ever curious who hangs those up, that was me in undergrad, my first semester freshman year. So I had, so I also kind of got to help design some of the messaging and was at a booth in the college center for any of the campaigns. But, those public health weeks, don't smoke, be careful what you drink, what's in that solo cup, freshman year, first semester, I was taking those signs and hanging them up in the bathroom stalls. So really glamorous start to public health for me.
So interesting to see how far we've all come, right? So this one, I think I'll direct towards Maya, but again, everyone can feel free to jump in. So Maya, what is one of the best or most worthwhile investments you've made? So this could be time, energy, money, but anything that you had to invest a resource in, and kind of how has that paid off?
Yeah, so going back to just income with jobs. So I was at a pretty good salary job before I came to the Washington Nationals, and I had to take a huge pay cut. initially before I got the job, but I found an opportunity and something that I would love doing, and that was a sacrifice that I had to make. So I feel like I made a sacrifice and just invested, you know, my time. It required way more time doing the work that I'm doing now than what I was doing before, but less pay. And that was a huge sacrifice. But I will say, you know, after 3 years of doing the job, I was able to work my way up. But again, I'm going back to what a lot of panelists said. Sometimes you really do just have to make that sacrifice. And that was a huge investment in my career that I made. That was a huge step because, I mean, as of now, I have 2 children, but at the time I had 1 child. So I was kind of nervous about taking that huge step to get that huge pay cut, but it was definitely worth it. So yeah, I would say that's probably like the hugest investment / sacrifice that I've made in my career thus far that's paid off.
I would say for me, it's more one of the best investments I make is in my, you know, sort of network, my friends, family, you know, and then, you know, colleagues who become friends. It's been invaluable to have support in this work. And, you know, I just moved back to Maryland. I lived in DC for about 10 years. My husband calls DC a city of sharp elbows. So he's from the Midwest. And, you know, but I fit that category kind of, right? I love what I do. I am defined by what I do, but I don't mind it. But I've only been able to do that because of the incredible support of friends and family, and knowing that I just have people in my corner who are rooting for me. That's been a huge part of how I've been able to do what I've been able to do and get where I am. And, you know, both of my parents are tuning in right now, you know, and like, I just can't, it's not something you can, you know, that's an investment, and you have to invest in your friends and family, and you can't, you know, like we all need TLC, and I send, you know, Mother's Day cards in the mail to my friends who are moms, and I, you know, send postcards to my friends when I go visit new cities, and because everybody likes getting snail mail, that's not a bill, you know, and stamps, you know, and then you're supporting USPS. So anyway, I like spending time with my friends and family. And that's something that, you know, for someone like me who is career focused and oriented, I could be totally absorbed by that. And it's been an important balance for myself, especially, you know, since getting married last year, you know, just balancing and investing in my friends and family is invaluable.
Sure. So I'll jump in with an investment that I've made. I have a commute, of course, every day to the office, as many of us do, or a commute to school. I invested in an audiobook service. So I found over the last year that I can quickly listen to many, many books commuting to work. So I would recommend, you know, looking into this type of service. There are many titles out there that can help you in your career, help you in your field, or really give you insight into everyday life or professional life. So that's an investment I've made that I think reaps benefits personally, professionally, and overall.
My mentor at UN, my main mentor at UN was Dr. Olivia Carter-Pocras, a Latina faculty, a role model for me. One day I told her that I wanted to be like her because she was my role model. And she told me, Mariano, if we are working so hard on your career development, you cannot be like me. You need to be better than me. Okay, so I am very grateful for all of the opportunities I have. I have a very important NIH portfolio now, So what I'm doing now is to invest in the next generation. What I'm doing is to help them writing their grants. And I am proud to share with you that my mentees, my students, have received NIH funding as a doctoral students. So that is my biggest investment. My biggest investment is in the next generation. And I'm doing that because this is what I learned at UM. This is what I learned, and I had this opportunity, and I want to give others, the next generation, the same opportunities I had at UM.
Thank you to all of our panelists for sharing. That was absolutely wonderful. So with that, our next question is directed towards Rebecca. So Rebecca, what advice would you give to a smart, driven college student about to enter into the real world? And then what advice should they ignore? So it's a two-part question.
Yeah, I think it's funny. I was just talking about sort of balance, right? I think balance is how you define it. I think when people say work-life balance, they think about, I'm going to work 9 to 5, and then I'm after 5, I'm out, and that doesn't necessarily have to define balance for you. So I think going into the career, public health, there's always work to do. You can work all the time, and you might really like it. I put an event in the chat tonight that I've helped plan outside, sort of with the APHA, with the American Public Health Association as an environment section member. So that's technically for volunteer role, but I love it. So define balance for yourself as you enter the workforce. You don't have, it's not necessarily working 9 to 5. It's not like, whatever it is, define that for yourself. And it's okay to say no to things also. So define balance, and it's okay to say no. You set those boundaries for yourself, know your boundaries. And the advice that you shouldn't listen to, I don't know. I don't know that anyone's giving me like bad advice. So yeah, I think, I don't know. Don't listen to the advice to, take the first job if it doesn't feel right, Oh, I know. When people say, don't take too long to find your first job because there'll be a gap in your resume, or don't leave your first job under a year because like that looks bad on your resume. That's nonsense. Like I just think we're in a whole new, again, to mention my parents again, each of them has been working in the same place my entire life. Okay. So that's the example I had. That's not going to be the case for me or anyone in my generation, almost anyone in my generation. We don't have 30+ year jobs anymore. I don't think, so just don't worry too much about, I've only been here 2 years. I've only been here 1 year. That's okay. Find a good fit. If it's not a good fit, it's okay to leave. But just don't, I did hear, like, oh, you're already looking. How long have you been at your job? So don't listen to that.
So yes, I would definitely say networking. Networking before you graduate is huge. That's probably one of my biggest regrets because I was so antisocial. So like I didn't network as much as I wish I would have, but I would definitely say network. And to elaborate on that and just give you some examples of some great ways to network entering the public health field, mentors. If there are people who have the job that you dream of having or doing work that you dream of having or doing, you don't have to necessarily look for a job. You don't have to reach out to them asking for a job. You can just ask to have a meeting to just pick their brain, just to ask some questions. You have no idea what type of relationships you can build just from doing that. Maybe asking can maybe your mentor, but networking in that way. Same thing with, some of your colleagues, some of the other students there. If you see that they're volunteering or, doing something that you're interested in, just ask questions. Sometimes we get into this mindset, especially when we're about to graduate, like, oh my God, I got to get this job. I have to do this, all these things. And sometimes conversation will just do the trick. That's networking within itself. we don't have all of the answers. And I know one of my biggest regrets is not tapping into the people who were in those positions who did have the answers. You know, I was so focused on getting that job and trying to figure out how to tweak my resume and how to do all these things to get there, when I could have just had a simple conversation, you know? And so that's like some of the greatest advice I can give you from my mistakes is just really networking and just stepping out there to have conversations with people and just asking questions. Advice that I would tell you to not follow. From my experience, in public health, specifically working in underserved communities, a lot of times I've been told that's just the way things are. That's how it's always been. Question it, go against it. That's not a good answer. That's not a good response. You know, you may hit different walls and think that you can't go beyond that. Always question, always push past, because that is exactly how we're going to move this public health field forward. To be honest, is just going against, you know, what we see and digging deeper and doing research to try to find answers. So despite, you know, what people say, telling you that, you know, you can't go further than this, or it is just the way it is, you know, this is how it's always been, never settle for that. Always, always question everything.
There are a lot of people who wants to help you, and we are some of them, but we cannot help you if you don't ask for help. So my advice is to knock on doors, and the right door will open. Something that I always tell my mentees is to say thank you. For instance, you may attend to different events like this one, and if you find a person who is interesting, send a thank you email. And then in the future, you can just use that email and reply this email and put it in the context. Oh, I saw you in this event and blah, blah, blah. I would like to discuss with you my research interests, and then, you know, you can establish, it's easier to start, you know, the connection. For those who wants to have an NIH-funded career path, don't be afraid of program officials. They are going to be your strongest advocate. So call them, not call them, send them an email and schedule a meeting, a Zoom meeting, and they are going to help. They are going to help. You know, so that is one of my biggest advice that I can give you in regards of what they should ignore. Okay. So you can learn from good people. You want to be like them. Sometimes you may have a coworker, sometimes you may have a professor who you don't like. So you know what you can do? You can learn. You can learn to do not be like this person. So turn negative things into positive things. Okay, and that is going to help you a lot.
So much great advice was already given. So I'll give some good, easy advice. You know, I think for any, you know, smart driven college student going into the real world, take on all this advice that's been given by all the other panelists. But here's some easy advice. Always be on time, always give the effort, and always show up. You know, I think those are the easiest traits that it's really not a trait. It's just anyone can be on time, anyone can show up, and anyone can show the effort. You don't have to be the smartest in the room. You don't have to have the highest credentials in the room, but doing those things will put you ahead of your peers immediately. Advice that I think you should ignore, you know, it's hard to say. You know, I think all advice is good advice, but you know, I would say some good advices, and I think Rebecca mentioned this, was know when it's okay to say no, or don't be afraid to say no. You know, I think all too often we say yes simply because we want to please everyone, or at least show willingness to do anything and everything. But I think there's strategy behind saying no to things that you either can't implement or you can't fulfill. So it's you know, that would be my response to that question.
Excellent. Thank you all for for your advice. And I hope that that was the good advice for everyone here to take, right? Take all that advice. So we do have our first question from the chat. So Mariano, if we can start with you, and then everyone can fill in and support. And the first question is, if you could go back and change anything you did during your time at UMD, what would you change and why?
I need a few more seconds to think about this.
I have an answer. I think so. I have sort of one answer actually from my undergrad. I didn't go to UMD for undergrad. I got my MPH at UMD. But for my undergrad, I remember I went to Franklin and Marshall College, and there's a strong environmental science program there. And I had come in with a couple of credits from high school, and I did some study abroad and got brought in credits from there. And so I had the option, senior year and sort of more second semester senior year to do a thesis or an honors. I had an extra credit, and I decided I'm not going to take the credit second semester senior year. I'm gonna apply for jobs. I was class president. I had a lot going on, so I wasn't gonna do it. And that's one thing I would change, is go back and do that. I would do the thesis. I would do the honors work, because I think I got, like I mentioned, I didn't get a job right after school, which led me to UMD. So I'm not questioning my path. I really, like how it all worked out. But there were a couple jobs where I got to like the final round, and and I think the one thing I was lacking was some sort of research experience, or, my name on a paper. And I think, so if you have the opportunity to get, be part of a research project, to get a publication in undergrad, whether that's peer reviewed or sort of just a published piece, in, somewhere, I think that's important. I think it will set you up for success. That's one thing I didn't do in undergrad that I could have done. And then going into graduate school, because I was sort of rushed to apply because the economy tanked and my plan wasn't going right, I didn't have the opportunity to really apply to school, like to talk to professors before attending graduate school. So what I tell folks in undergrad who are looking at graduate schools now is find the professors who are doing the work that you want to do, and go and talk to them and ask them before you apply, can I have an assistantship with you? Can I, please pay for my graduate school education. I will work for you for 2 years and you'll pay for my education. That's how grad school works. They need, professors need assistantships. You can teach, you can do research, you can be in their lab. And I didn't know that. So I didn't have the opportunity to have that discussion with professors before coming to school. Now I did end up TAing for actually the environmental science department across campus, which was a great exposure for me who like Maya said, wanting to go into advocacy. I have been a lobbyist in the past, getting that experience in the, teaching environmental policy while being a student in public health really was a great experience for me at University of Maryland. But I encourage folks who are looking at schools, going to graduate school, talk to those professors and get that assistantship lined up as part of your application process, so that you can graduate debt-free from graduate school. Now, again, my story really worked out because Dr. Jacoby Wilson came, nationwide known and respected environmental justice scholar, came to UMD my second year of graduate school. And so I was his, very grateful to be his first graduate student at UMD. And so it did work out. I'm very grateful for that because, he and I still continue to work together and support each other to this day. But that I encourage people to have that conversation before applying.
Okay, so I'll go. One of my biggest regrets from undergrad would be gaining more experience. I will say, as you enter the work world, especially if you have student loans and you are looking to make a certain amount of money, I found that a lot of jobs are not only looking that you have the degree, but you have a certain amount of experience. And because I did not put myself out there for a lot of internships and networking, that was a difficulty of mine entering the work world, trying to achieve a certain salary, because they were like, great, you know, you have a degree, but you have no experience in some of these things. So it took me a little bit longer to get to where I was at because I had to get that experience. So I would definitely say that that was one thing that I wish I would have done a little differently. So take advantage of that while you're still in school. Get internships, volunteer. I mean, even if it's free, get experience. Because honestly, that's going to be huge when you start looking for jobs. They want to see not only do you have the degree, but you also have experience doing the work. So yeah.
Yeah, I think my answer to this question is probably in line with Rebecca and Maya's. I would say be more involved, rely on your faculty, and try to participate in projects outside of scope of simply your academics. I think there's a lot of opportunities to support research or other efforts that, again, aren't directly related to your studies. But that goes a long way when you are going into the workforce and you are building your CV to show the diverse experiences you may have had. So I think one thing I would have changed at UMD was expose myself to more on campus that was happening. And don't be afraid, rely on your faculty at SPH, and doors will open, like Mariano said, knock on doors, and many may not open, but all you need is just that one door to open. So
being in academia is not like a paradise. There are good things, there are bad things. When I was a student, sometimes it was difficult because some classmates labeled me because of my background, because of my accent, that I was a second-class student. And I didn't raise my voice. And I think that this is something that I will change. Now, you need to understand that they were different times. This is like 10 years ago, and they were different times. So now I will tell you, if you experience that, just raise your voice. And if I can help you, look me as a role model and see that you can succeed. Okay, so don't listen to negative people, and raise your voice. This is happening to you. I didn't, and now I think that this is something that I regret.
Thank you, panelists, for sharing. It's amazing to hear just the life lessons that each of you have learned, right? And are able to share that wisdom with now the next generation, right? Those who are listening in. Our next question coming from our chat box is, what can young people do to begin their public health journey? And how can we inspire youth to share the same passions we have? And I will begin this question by being directed towards Martin. Oh, I'm sorry, Martin, I believe we still have you on mute.
Oh, sorry about that.
That's okay.
So, I think, again, what I said for the previous question really bodes well to answer this question. So I think, you've taken the first step. If you are in the School of Public Health, you are in a major related to public health or community health. But I think if you really want to take that first step, unpaid internship, volunteering, asking faculty to help with their projects, find those opportunities that aren't paid but will pay you an experience. I think that will really again drive your career and start your career. And I think try to go for many diverse experiences. Don't simply narrow your focus to one topic or one professor or one subject that you're interested in. Try different topics. I think I took an environmental science course in undergrad, and I was amazed. I was very interested in it. Didn't think I was before I took it, but interesting to read and learn about. So expose yourself to diverse experiences, and don't be afraid during college to stress yourself out economically, because I think in the long run it pays off.
Wonderful. Thank you, Martin. And there is just one point of clarification that in terms of inspiring youth, the target population is more directed towards middle school and high schoolers.
Let me think about that one for a second.
Okay, so I can chime in on that. That's the population that I am, working with at the Youth Baseball Academy. So just to kind of tap into that clarifying question, to get them to share the same passion, you have to tap into something that they're already passionate for. My demographic, they're very passionate about sports. They're passionate about music. They're passionate about dance. So I try to infuse all of my health and wellness information within sports, within dance, within music. We do have kids that are interested in cooking. So I could take them into the garden and we learn like farm to table things. But I want to say like the easiest way to get kids to gravitate to public health issues in general is just tapping into what they're already passionate about. That's just the easiest way to grasp their attention, and you can just infuse information that way. Also building relationships with them. Being that adult that they feel like they can trust will make them gravitate to what you're trying to share with them. And to just tap into the first question where you said, what can young people do to begin their public health journey? Just to pretty much piggyback on the rest of the panelists, I would say volunteering, internships. And when I say volunteering, it can be as simple as if you want to come to the Youth Baseball Academy and play with some of the kids, if you're in family science and do some activities with them, you're more than welcome to do things like that. There are tons of urban gardens around. There are tons of different organizations. Honestly, if you call an organization and say you just want to volunteer to help, most of them will allow you to do so. Like a lot of organizations in public health are looking for volunteers. It's really just you taking the initiative to contact them, and they will be more than happy to bring you in and to kind of allow you to have opportunity to volunteer and learn about what they're doing, because a lot of public health organizations, that's what they want to do. They want to advocate. They want to get the word out. So you being a public health student at UMD is very attractive to, organizations like, where I work, and I'm sure like where a lot of our panelists work. We want to advocate. We want to get the word out about what we're doing. So contact us. Say you want to volunteer, say you want to get information. I think that's a great way to kind of start your public health journey.
And I'm prepared this time. So to add on what Maya said, I think how we can inspire youth is hosting youth, and I think Maya put it greatly. I think many times when we're in our careers or we are busy doing our busy within our roles in our professional life, we don't take a step back to devote some time to the youth. I think almost every major hospital or major academic medical center or university probably has some type of volunteering office. So reach out to that volunteer office, offer some time. And I think bringing youth or bringing a high school student or middle school student just for a share day, I think that'll go a long way to provide value and really show what we do and why it's important for the greater of everyone or the greater good of society.
And just to build on what Martin and Maya were saying and start to answer one of the, because I recognize the time, one of the answers to the next question in the chat, which is about what about if you're trying to get experience with limited time and sort of everybody online right now. I'm actually going to go back and lift up something Maya said early on, which is advocacy. I think what you do not, so one example, right? The Lancet Countdown on Climate Change and Health, the US brief was launched last week on the 21st. And so there was an online launch event. And, this is an annual report that comes out with global indicators to tell us, what's the progress on climate change? What are we seeing in terms of impacts to human health? And shortly before that, there was another report that came out. And next week is COP, the Conference of the Parties, this big global climate change conference. So your elected officials need to hear from you right now about how important it is to take action on climate change for our health, our children's health, the health of future generations, the health of older adults in our lives. They need to hear from you, and they value your experience and expertise as a public health professional. So tune in to online events that are happening all the time. I put in one that's happening tonight on environmental justice, one that's happening next week as we launch our mental health and climate change report. Tune into these events. So that's maybe an hour and a half commitment, and then call your elected officials about this and gain experience talking to decision makers about the topics you care about. And then you can say, when you're applying for jobs, or you're thinking about your graduate school thesis, I have experience advocating. I have called. You'd be surprised at how many people haven't called their own elected officials. And so do that. I mean, that's something that could take, so you're maybe talking, 10 hours, every 6 months, maybe, not too much time. It takes a few minutes to call your elected officials and have them hear your voice on this topic. And there's just an embarrassment of riches right now of online programming for how you can sort of, that's one of the ways you could do it. Tune into an event and then take action on it, take an advocacy action on it, and then build your experience that way.
I will briefly mention why it is important to volunteer and to be involved with the community. It is important because it will allow you to understand what is public health. Public health is not about p-values. Public health is not about an ID, a participant's ID. Behind each participant ID, there is a person, there is a family who needs support. And in order to understand the meaning of public health, you need to be in the community. You need to learn from the community. So that is why it is important to volunteer and to be involved with the community and serve as a role model. Many people think that public health is not for them, but you can show them that, yes, this can be for them.
Thank you so much, Mariano, for ending on that really positive, awesome note. And thank you to all of our panelists, all of our guests today for attending. It is time to wrap it up. I can't believe it. It went by so fast. And I want to hear so much more from all of you, but unfortunately, we do have to wrap up today. I did just want to quickly plug, this was recorded. And so for anyone, a guest or panelist who want to go back and, listen to the information your fellow panelists shared, or share more broadly, it will be posted to the School of Public Health YouTube page. So thank you again for a wonderful event, for all those who organized, all those who attended, all those who volunteered their time. We appreciate it. And I do see our panelists are, Maya put her contact information there. Panelists, if you wanted to, you could do that as well, for those who may want to reach out afterward. So with that, I believe we're ready to close.